Hi, I'm Sanjib Majumder. I'm a plastic surgery consultant in Yorkshire, and for our medicine in a nutshell talk, we're going to discuss topical negative pressure dressing, commonly known as VAC dressings. Now, but what is VAC dressing? VAC is actually an acronym. It stands for vacuum assisted closure. This was a term coined by Dr. Argenta and Mr. Morikos in their seminal paper in 1997, Annals of Plastic Surgery, when they described the topical negative pressure device. Now, this vacuum assisted closure dressing or topical negative pressure dressing, in my opinion, revolutionized the management and care of wounds in a big way. Now, historically, if you go back in 1993, there was a Dr. Fleischmann who published in a German language paper talking about vacuum sealing as a treatment of soft tissue damage and open fracture. But it was Argenta's paper that actually springboarded the whole thing. Now, what types of what are the kit then? Okay, so first you've got a bit something like foam, which is the black foam, which is the most commonly used. This is made of polyurethane. There's also a white foam, which is made of polyvinyl alcohol. This is only available from KCI, the original people who marketed this device. And the difference between these two is this has larger holes, these are smaller holes. This is dry, and this is actually wet, and you can see when I squeeze it, it has fluid coming out of it. And because of this, the pressure, the negative pressure under the foam is actually less with this, and it keeps the wound a bit moisture, which may be a good idea if you've got structures such as exposed tendons or exposed nerves. But if you've got a wound that is quite exudative, this is probably not a good idea. This is a better idea. Now, the other thing that people put as the interface there is is a gauze. I apologize. And the gauze is essentially an open mesh gauze. This is Kerlix, that's manufactured by a company called Covidian. And this open mesh gauze has something called Polhexamethylene Biguanide coating it, which is supposed to decrease colonization of bacteria because antimicrobial. Important to remember, please do not use any of this in an infected wound, in a cellulitic wound, in a wound with pus, because you create an anaerobic environment, and that is an absolute no-no, because you promote anaerobic organisms from growing, and B, once you put the topical negative pressure dressing on, you may not want to return to it for 3 to 5 days, in which case the wound is not being looked at. So not good wound care. When you put these dressings on, the next thing, once you put your foam or gauze, whichever you choose, you then put a film dressing like this. It's a transparent film dressing which goes on top. You make a hole in the film, and then you connect it up with this tubing, and this tubing has got a bit of sticky pad. It's got a track pad. You stick it on hole to hole, so there is a closed circuit which then goes on to a machine like this, which consists of a pump and a canister. Our video on the application of the topical negative pressure device has a much more detailed account of how to do all of this, and I would suggest that you do look at that. It's pretty good. Now, even if I do say so myself, when you've put the dressing, you tend to leave it for 3 to 5 days, and when you're taking the dressing off, it can be somewhat painful, especially if you've used something like the black foam, because it's caused a lot of granulation. The granulation tissue gets into the black foam. When you're taking it out, it may rip it off. To decrease that, you can put an interface, something like a silicone layer, such as Mepitel or any other silicone dressing, so it doesn't stick. However, in my experience, that decreases the efficacy of this, so I don't tend to use that. I would use it straight or neat on the wound. But when we're taking the dressing off, if the patient's awake, before we actually take the foam off, we put a bit of local anesthetic down at the tube after you switch off the vacuum, so it permeates the wound and it allows the dressing to take it off much more gently and kindly. In some instances, you will have the patient having to have this dressing changed under general anesthetic if it's a large dressing. Now, One thing about your gauze is that the gauze is a lot more malleable than the foam, and as such the gauze is quite good for nooks and crannies, so large wounds like in war wounds, or large the pressure sore areas, or difficult to pack areas. I think the gauze is pretty good. There's a fourth type of foam which I'm afraid I don't have here, which is essentially the black foam, and top has got a bit of silver on it to reduce decolonization of things like Pseudomonas. So those are the different types of foam there. But how does this topical negative pressure actually work in terms of wound management and increasing healing? Well, let's bring our poor chap with his leg wound again. There are multiple modalities that have been theorized, because lots of studies have been done on animal models. People have analyzed the fluid that has been sucked away, etc., etc. The first thing is that when you put the topical negative pressure, there's a topical negative tissue expansion. So essentially the edges of the wound are brought in, so the wound gets smaller. Okay? There's a mechanical deformation or stress within the tissue, which results in protein and matrix molecular synthesis, helping with the healing. There's of course removal of all the fluid, all the interstitial fluid, and there's localized edema is decreased as a result, and also the suspended cellular debris and osmotically active molecules and biochemical mediators such as metalloproteases are sucked away. And we know this because they've analyzed the fluids that have been sucked into the canister, and this may help create a microenvironment which improves wound healing. There is increased blood flow, and that's been shown in animal models, up to 4 times blood flow, which in turn decreases the tissue bacterial levels because the white cells and so are coming in. There's enhanced angiogenesis and granulation tissue formation, and possibly enhanced epithelialization as well. So multiple modalities for wound healing. In terms of wound control, where you're not trying to actually heal the wound but control it, because you've created a closed system with your vacuum and your film dressing connected to your machine, that prevents contamination from the outside. And this is the reason where when one has an open tibial fracture, it's now recommended by BOA and BAPRAS that after the initial wound excision, if you're not going to close the wound right away, you could put topical negative pressure as a temporizing thing, not for healing, but to actually decrease contamination. So lots of theories about it. Now, in practice though, a couple of things. You put your topical negative pressure on your wound, you've got to then decide, what sort of pressures do I put it on? Well, the recommended pressures for the manufacturers for the bigger machines are the 125 millimeters of mercury, which is supposed to give as much as 4 times enhanced blood flow. One must be careful not to crank up the pressures too much on the view that the higher the pressure, the more blood flow, the more granulation tissue, because you can actually reach a point where it starts to have a negative effect, possibly because the small capillaries are actually being collapsed down with the increased pressure. So 125 is probably about right. If, however, the patient starts to complain that they're having discomfort because of the pressure, you may want to decrease it. Interestingly, there's a smaller version of the machine, which is a Pico, which does only 100 millimeters of mercury, but that's for smaller wounds. And the technology is somewhat different in as much as there's a pump creating a vacuum, connected tubing to this, which has a seal, so you have an airtight seal. But instead of the canister, everything goes into this pad, which is essentially like a nappy, sort of a pamper type technology. So it soaks into this, so it's a much lighter. It's quite a small device, and you just press on and off. You don't have all the extra functions of what sort of pressures to get, etc. And the next thing is intermittent or continuous, because when you've got a bigger machine like this one, you do have the option to make it intermittent or continuous. Again, the general guidelines, intermittent is supposed to be better in terms of blood flow and so on, but some studies have shown that continuous for the first 48 hours, then intermittent may give you a good result. Having said that, I know a lot of people just go with continuous, some go with intermittent, and it is a little bit of surgical preference because the evidence isn't hugely compelling for either. So finally, where do we use these topical negative pressure dressings? You know, we learned about the history and how it works and etc. So obviously wounds such as wounds on the leg, wounds in the perineum, which, you know, it revolutionized the whole wound management and improved wound healing. Pressure sores, for instance, large wounds after necrotizing fasciitis. So plastic surgery use it quite a bit. You can use it for temporizing after you cleaned the wound and debrided it, like an open tibial fracture. Some people are using it, and I certainly do use it on skin grafts because the foam and the negative pressure actually pushes the skin graft down so that you decrease the amount of shear and also sucks away the fluid. And this is for, obviously, the skin graft will have to have holes to allow all of this to happen. And this is meshed split thickness skin graft. And you can look at our video on skin grafts, which will give you a bit more information about the different types of skin grafts, for instance. And finally, people have now started using it after they've done actual incision direct closures. And there may be a feeling or some evidence that it may improve healing and decrease the infection, but that remains out there just for the time being. Okay, so now that is essentially an overview of topical negative pressure, also known as VAC, in a nutshell. But we've done another video which is much more comprehensively looking at how you put on topical negative pressure application, and I would strongly suggest that it's a good video for you to look at. Hi, I'm Sanjib Majumder. I'm a plastic surgery consultant in Yorkshire, and I'd like to invite you to have a look at, subscribe, tweet, and even contribute to the Medicine in a Nutshell series that we're creating. It's essentially a series we're creating where we're getting information and knowledge about anything related to medicine, not limited to doctors, not limited to one specialty. And what we want to do is to populate it with short videos, 10-ish minutes long, by people who are expert in the field on the subject that the subject matter, so to speak. So please look at our videos. Please give us a thumbs up, please subscribe, please tweet, please get in touch. It's your website. Please contribute to it. Thank you very much.